All right, we're live, Dr. Emer.
Come on close in. Hey guys, it's Dr. Emer. We are doing TCA Cross, one of my favorite treatments for acne scars. Now here's the thing, if you go on Amazon and buy some TCA and apply this to your skin, that's a no-no. You can get a lot of scars, you can get pigmentation issues, redness, and even worsen the scars. We're doing something called TCA paint. And you can see we're around the edge of more spreadable scars. We're painting the edge with TCA so the edge blends in, because for very deep ice pick scars, you want to go directly into the scar. For those scars that are a little more broad, like he has here, where he has some of these lighter ones, we go around the edge, we just paint the acid. This is not something you would do if you haven't done this before. Definitely a more advanced technique, but really helps some of these broad scars turn to the right before we decide to go and do our laser treatment. So again, something like this here, we paint the edge, same thing here. And what we're gonna do right after this is Fractora, which is the deep microneedling radiofrequency. It's gonna really build collagen here. The other thing it does, and he already has like the most perfect jawline, lips, but that's gonna tighten everything. So he's gonna get an even better outcome.
What's the frosting?
Well, that's the acid, you guys. So the frosting here is the acid. This is all dyeing the skin. And so you want to make sure, this is why we don't do this unless someone truly needs it, because it could cause worsening scars. And so some of these, again, like you see here, this sort of irregular texture, we're just going to go around the edge and do a little painting. So he needs more paint, TCA paint, than he does the actual ice pick TCA.
How does this differentiate from ice pick TCA?
Well, again, remember I said the ice pick ones, you go directly into those scars, and then you see a little circle like that. And these scabs will form. They will then peel and then heal within so that they build up the collagen in that area. Okay, now let's go to the left again. Now you can see that all of the frosting has taken effect. And the biggest thing you have to have when you do this type of treatment is something called patience, because you gotta let the acid kick in. Otherwise, you'll overdo it. You can see the surrounding redness that he's getting, which is normal. And from side light, and we're pulling, we're looking, everything looks great. He doesn't need much more there. The rest of this just needs energy-based treatment. So you can see again, right here, we've painted a little bit on the borders of these scars. And
now, is this a self-neutralizing acid, or do you have to neutralize it?
we're gonna use aesthetic, you know those questions. Turn to the right. So he just asked, is it something that you need to stop it from working, or does it stop working on its own? So TCA is self-neutralizing, you guys, meaning that the more you put on, the more it's gonna keep going. So you have to really understand what you're doing, and that's why you have to have a little patience, because this is neutralizing, and if you put it on and then it goes too far, you made a mistake. So you want to make sure, obviously, when you do this, that you're using the right type of treatment. Now, some glycolics, for example, need to be neutralized. Salicylic acid is another one that doesn't. So it just depends on, perfect. So it just depends on what type of acid you're using. He also has one you can see right here. So we're going to do a little treatment on that. That's more of an ice pick type. If you look from the side light here, you can see there's a regular texture, but that's not for TCA, that's gonna be for the Fractora. So what I'm gonna have, over this area, we're gonna do 2 passes on the Fractora, but the rest of the face, I would just do 1. And you can see again, we just did that TCA, so we're gonna just do a little bit more, but again, remember, you have to have that patience, because it's gonna self-neutralize, and then you don't know how far it's gonna go if you put too much on. This is perfect, this is an even frost. Turn a little bit again to the left. Look at the ring. Look at the painting. Could probably do a little bit of painting on this one too. And then he's good.
What's the pain level like?
What's the pain level?
No pain.
No pain? Oh my God. He's so good. That's great. So yeah, I mean, overall, this is a good maintenance treatment for those that have deeper scars, ice pick scars, and then now we're gonna do our energy-based treatments, whether it's laser or microneedling radiofrequency with him, since he has a broader area. The microneedling radiofrequency, which goes deep, will be good for collagen production. So we're gonna do Fractora on that one. And then you see here, there's the TCAs. Those are perfect. Those ice pick scars. The rest of this, we will treat with our microneedling. So that's TCA Cross for acne scars, guys. See you soon. Perfect. All right, good.